Welcome to today's edition of 21 Days of Self-Care, and I've got my friend Diana here with me. So Diana, tell everyone a little bit about yourself, who you are, what you do.
My name is Diana, and I'm a pelvic floor physiotherapist. I help children ages 5 to 17 if they're having issues with leaking or bedwetting or constipation. And then I work with women of all ages who experience pelvic pain or people who are preparing for pregnancy or recovering after pregnancy. I also have a particular love to work with refugees who've experienced pelvic pain secondary to trauma that they might have experienced leaving their country.
Okay, that's definitely a lot of different demographics. If you had to pick one, and somebody said, Diana, from now on, you can only work with this one group, who would it be?
I love working with children. So I really
Nice.
enjoy helping kids overcome pelvic health issues. And if they can get their health in order at a young age, it prevents things from happening later on.
Makes
My
sense.
interest in bedwetting came seeing like a person in university who's bedwetting, and I met another woman in her 30s who is married. And I thought, man, why was this not addressed years ago? So if we can catch things early, it's really important.
That's great. That sounds super important. It's not something we talk about much. I'm assuming it carries a lot of shame and stigma for people to talk about publicly, but people need that support, right? Yeah. I mean, we all went through that phase. We don't talk about it.
We do.
But we all went through that phase, and I guess for some people it takes a little bit longer. Okay. So with this challenge, we're really challenging people to do something for their health and for their self-care. Movement is a huge theme for us. So how does pelvic health and movement, how do they relate to each other?
So your pelvic floor muscles are like a hammock. I have my pelvis here.
Ooh.
So here's our pelvis. So it helps to hold everything up, all your organs up. You can see it. It's kind of like a trampoline. So whenever we move, cough, sneeze, these pelvic floor muscles need to support you. This is your bladder, uterus, and your anus and rectum.
So woman.
This is a female pelvis. So particularly for our females who are trying to be more active, whether they're doing weightlifting, if they're doing some running, fast walking, any sports, these muscles need to be strong to prevent leaking. Or some of your organs will start to drop down and you want them after pregnancy, and so you want to support them and hold them up. On the reverse, if your muscles are too tight, it can also cause leaking, but it can also affect you and cause pain, whether pain with sex or just pain in day-to-day life, or can cause increased urgency, so if you're having to go pee all the time. So it's really important to know about this part of your body to live well.
Yeah, that sounds super important. Everything you said, we all do that every day pretty much. And so, okay, of course, there's a lot of things we can do for our pelvic health, but if you had to pick one thing that we can do, all of us can do today for our pelvic health, what would that be?
One thing. I think it's really important that we breathe deeply, diaphragmatically. That really helps to relax the pelvic floor, puts less strain on it. If we're holding our breath, it puts more pressure downward. And the other thing would be to drink enough water, which I'm sure many of your interviews have talked about.
So breathing and drinking water, they sound so simple, but why do you think it's so difficult for us to actually do it?
The breathing piece, I think our society just moves really fast right now, and we're often holding our breath, holding a lot of tension, and that in turn puts tension down on our pelvic floors. So it's trying to find those times in your day when you can make space to simply be present and breathe, which is so helpful. And drinking water, I don't know why we struggle with that. Yeah, that's an interesting question.
Yeah, and I know I can definitely relate to the breathing one, because sometimes, depending on what's going on, I have to kind of catch, like, one of the things that I'm kind of known for is like forcing people to take a minute during meetings. Sometimes I'll be like, all right, we're all just going to take a minute. And literally, it's like for me to just breathe deeply, because if I don't do that, sometimes I can go from meeting to meeting, depending on what's happening. I may not be able to breathe that deeply. So it's interesting that you bring that up.
That's amazing. That's a really good practice. I think as someone who has had my own practice, like definitely we can get go and forget just
Yes.
to take a moment to be present with our bodies.
Okay, we're gonna take a minute right now because we're talking about it. We're gonna. Oh man, I was just getting into it. That was lovely. Thank you for doing that with me.
You're welcome.
So you spoke a little bit about postpartum. How are women, especially maybe predisposed to having pelvic floor issues, especially after children?
Yes. So this is our uterus. The uterus expands like 1,000 times its size when there's a baby growing inside. It's amazing. And pelvic floor has to hold baby up along with everything else. And then when if there's a vaginal birth, all the tissues of the pelvic floor are really stretched to allow baby to pass through. And also, like, abdominal wall can be stretched. There can be diastasis rectus abdominis. It's like when there's separation of your ab muscles. And so postpartum, it's really important to strengthen things again and get that coordination back. Some women will be experiencing leaking with coughing or sneezing. It's really common. Or sometimes they might feel that there's heaviness or like something coming through the opening, which would be a prolapse, which is very common, but also very, very treatable.
Right.
And so I think I haven't had my babies yet, but I know I will be checked by a pelvic floor physio afterwards to see, because sometimes it's hard to get a sense of where things are at. And then also, if there is some tearing, that tissue will heal beautifully, but sometimes you need to do some massage to help it move again well, again for comfort, either with intimacy or just with bowel function as well. Just thinking through those like ways that we go pee, positions. So I think that's really things that are really important. And also preparing like before you have a baby is important as well. There's things that you can do to like strengthen and prepare. Also ways you can stretch your perineum. There's really good evidence that stretching, especially with first time moms, will help to decrease that risk of tearing. And the more awareness you have, the easier it is for you to relax and let go during the labor and have it be a little bit easier on your body overall. If a mom has a C-section, so it's like an incision this way, there also can be like effects on the body, like long term. There can be sometimes more stiffness in the back, and we want to like address that. So getting that scar moving well, again strengthening the core. It's just like a major change and a major surgery, in addition to adapting to having a baby and sleep deprivation and feeding, whether you're breastfeeding or using bottles. So yeah, there's so much.
It does sound like a lot. And you mentioned painful sex earlier. Would you say that women who struggle in that way are more likely to struggle postpartum, or there's no correlation?
I don't think necessarily. I think I have worked a lot with women who've had painful sex, so probably like more than half my caseload previously was people who had pelvic pain. It's really common and also really treatable, and so that makes me want to tell you guys, like, it's not normal to have pain, and this is a very beautiful part of people's lives, and it's something that you can explore to get free from pain and to have hope in it.
Okay, how long does it take typically for people to go from painful sex to pain-free sex?
So there's different variety. Like dyspareunia means painful sex, but there's like different, like sort of a spectrum. So there can be like a vaginismus. So this is like when this is the pelvis, like the muscles will actually spasm shut. Like imagine if someone's trying to stick their finger into your eye, how it closes.
Of course, yeah. Don't poke my eye.
Exactly. But in a similar manner, if someone has vaginismus, their pelvic floor will like spasm shut,
right, yeah,
and they can achieve no penetration. So with a vaginismus, it could take like 6 months, it could take like a year and a half, sometimes less. It just sort of depends. If people are having painful sex, each person is different because there's the tissue, but then there's the mindset.
True.
So like with a computer, there's the hardware and there's the software.
Right.
So the hardware are the muscles, bones. If you've had a fall on your tailbone, all sorts of things can impact your pelvic floor. There's the software, like if pain is a really fearful experience to you, depending on your background, if you grew up in a really conservative, whether I typically have seen a lot more people with vaginismus who are of Jewish, Christian, or Muslim backgrounds. And so thinking through what do you think about sex and what are your beliefs and baggage coming into it. If someone has had a history of trauma, of course, there's lots of things that they need to work through with people, not just with myself. My mic. Yeah, so then it can take longer. So each person is different, but there is
depending
so
on the
much
journey.
Hope. Yeah.
That's really cool. Very cool. So it's good to know though that at least people who are more likely to have painful sex are not necessarily more likely to have more issues postpartum. That's good, because imagine that. It would be like, great, pain here, pain there.
Well, I mean, if someone has vaginismus, obviously there's like more challenges with labor because it's the same thing of thinking of relaxing and letting go.
Yes, letting go and letting the baby's head come out, because the spasm, like you described, makes a lot of sense. Okay. So in regards to postpartum, we end up seeing quite a few people, whether through pregnancy or postpartum, because of compression therapy that we provide. How does that influence like pelvic health or health in general in your experience?
That's amazing. It's cool. Do you guys offer compression above the legs, like pelvic compression? Like, do they? How high?
That's a great question. Yeah. So there is maternity compression, so that would kind of go over. However, generally speaking, we don't have much compression in the pelvic region. Like it starts to get looser as you get up there, just so that it's comfortable. But is that something that you feel people might need, like a little bit more support? Okay.
So I'm thinking about what you're talking about. Like sometimes I always see varicose veins in people's labias and like a lot of excess pressure. Sometimes people push themselves a bit too hard. Sometimes you're running like late into pregnancy and there's like a lot of pressure. And I've seen like varicose veins in that area as well. So I'm curious to learn more about your products. To see if there's anything to support women in that situation.
Yeah, I would assume it would be more the maternity pantyhose, because the varicose, the good thing about the veins is that because they're kind of running all the way up, is once you give some areas more support, it goes all the way up and it kind of connects, and it allows those veins that feel like they're really inching to kind of relax a little bit, and it allows the walls to kind of flatten a little bit more. So compression socks don't take away varicose veins, but they do reduce the appearance, because now your veins can rest and they're getting the support they need, and they don't have to carry all that pressure that they're carrying. So it does help in that way.
And so is it something that I'm interviewing you?
Yeah.
But do you have to, if someone has varicose veins, will they eventually be able to wean off of their compression stockings? Or
it depends. It depends on why they have varicose veins. Like if it's situational, for example, like in the case of pregnancy and postpartum, absolutely, they most likely would be able to wean off. If it's genetic and induced, it really just depends on why they have varicose veins. But the good thing about compression socks is that there's different pressure levels. So most of our clients are more likely to kind of go down a pressure as opposed to like wean off completely, just because of the preventative care. So like I wear compression pretty often, not because I have like issues with varicose veins or things like that, but because I want my legs to be better supported. I want that health benefit. I want that circulation boost, because I'm big into movement. And one of the things that stops people from moving is pain. And so if there's pain or discomfort while moving, or even while sitting or working, then people are going to be too tired. Like you've done a 12-hour shift, your legs hurt, and now you're telling me what? I have to go for a walk? Like, nobody's doing that. But if they feel great after work, then they're more likely to go out. So a lot of our clients are more in that boat where they don't necessarily have varicose veins. They more want to feel healthier during their workday.
Fascinating.
Wow. Yeah. But that's really neat. The like just like that whole connection and the curiosity. I think we can definitely do some experiments together and and see how that goes. So, what is one thing that you think most people do not know about pelvic health, apart from some of what you've already shared, that you think is an absolute like disservice if we left this interview today without people still not knowing that?
I think that people need to know that your pelvic floor, you can leak when you're too loose or too tight. And so doing Kegels is really not for everybody. And sometimes doing Kegels can make things worse. Sometimes that's some of my concern around, I'm not sure what it is called in Ottawa, but the Kegel throne where you sit on a machine that like zaps your pelvic floor and makes it get tighter.
I have not heard of that.
Okay.
Is it comfortable? Is it like, I don't know anything about that.
I haven't yet tried as a mystery.
Okay.
I want to try as a mystery shopper.
I'm very curious what they're called, but it's basically a machine. You sit on it and it helps
contract the pelvic floor muscles.
Very interesting. Okay. So tell us why it's not for everyone.
So if, as we talked about earlier, if your pelvic floor is already too tight, then the throne making you do contractions is going to make it tighter and can make the leaking worse. So before you start launching yourself into a program of Kegels or going to a Kegel throne treatment, it's important to get checked by pelvic floor physio and get some good recommendations. So
that makes a lot of sense, right? You don't want to make it tighter, right? There's no, I know there are reverse Kegels that you can do. Is there a reverse Kegel throne? No. Well, that's a problem. But yes, it's good to get evaluated so that you can. That makes a lot of sense. Well, on that note, that ends today's edition of 21 Days of Self-Care. See you tomorrow.